COVID vaccines. I thought I'd start with some vaccine news, which you probably already have heard, right? But again, they are recommending, there's supposed to be something coming out August or September is what they said, and that anyone 6 months old and older should get a booster of that, right? So that would probably involve all of us. As long as you've had a 4-month period since your last booster of COVID, you are eligible for that. So watch for that. It's not out quite yet, so I don't know how fast that will come. And it said it's formulated to protect us against the current parts of the virus that are circulating, right? You know, it's just morphing itself all the time. These viruses are so smart. So watch for that in the fall and get that, you know, along with your flu shot or, you know, close by, just kind of pay attention for that as well. There is some question about, you know, if you go, they will often say, oh yeah, get everything at one time. You can get your COVID shot, you can get your flu shot. And last year they were pushing the RSV shot quite a bit. I knew somebody that got all 3 and did really well. I knew somebody that got all 3 and they like were laid up for a week or so. So you may need to know your own system and how you respond to that. I am of the mindset, I'm just going to give my body one thing to do at a time. So I kind of spread it out. Even a week between can be, I think, helpful. So let your body work on your antibodies against the flu and then go get your COVID shot and let your body work again. So that's my own theory. There's nothing scientific about that, but I also feel like it might lessen the overreaction your body could have for that. And in terms of that RSV shot, if you got one last year, it is not recommended that you have to get it again. It looks like there's some up in the air in terms of like what the recommendation is in terms of how frequently to get that. But they do say for those of us 60 and over, it's a good idea to get that. That RSV is the virus that really hit kids bad the last couple of years. I don't know if you've heard on the news, like Lori Children's was really overloaded and children were dying with this virus. So it's pretty severe. We had a church member, 6 months old, and he was in the hospital for 2 weeks with it. And it was really scary for his parents, you know, to kind of watch the way he struggled, particularly in the beginning. Right. So it's a severe virus. So I would say, put that on your to-do list. If you didn't get a shot last year, you should do that this year. Yes.
It seems like there's been a lot of notion about single thinking.
Yes.
How significant is that for us that you have a single?
If you haven't had a shingle shot, I would recommend it. And I say that from somebody I've had shingles, and it's a tough thing to fight. If you've ever had shingles, you will know that it's worth getting a shingle shot. It doesn't mean that you won't get shingles, but it's kind of like all these vaccines. It may lessen your response to it, right? So it'll be much less, but shingles is no fun at all. And what happens for some people with shingles, it can turn into a chronic kind of a disease. So if you can get your shingles vaccine, I would say do it. You know, if you're getting everything else this fall, make that happen now. Go ahead and get it now, or, you know, start that after you go through your other vaccines. It's a 2-step vaccine. So you get one shot and then you have to wait 3 or 6 months to get the next one. So that follow-up is really important for it as well. So I would recommend it, shingles. Yeah. It's a hard disease.
I have a question on the RSV shot.
Yeah.
Is that a one and done, or is that like the flu that you get every year?
From what I'm seeing, I'm not finding a clear answer on that they think it might need to be repeated. But there was such a big push last year. If you had it last year, don't get it this year. You should be well protected is what I'm finding.
Okay.
Yeah. Yeah. The flu shot this year, this is very interesting. It's a trivalent, meaning that it, you know, protects you against 3 different kinds of flu. So it's the H1N1. You've heard of that. That's common. It protects you against the H3N2. And then the third thing is a B/Victoria lineage virus. Isn't that weird? Somehow Queen Victoria got in the flu business. So we're going to be protected against that as well. And that myth that if you get a flu shot, you get sick from it, they say that is really not true. You can have a reaction that might feel like a little bit of a mini flu, but if you have a true flu, like if they've swabbed you for the, you know, the influenza A or B, you're going to be pretty sick for like at least 10 days. Some people it's 2 weeks. So you know, a day or two of kind of not feeling your best is really minor compared to what the flu, when it hits you, is like. So I would say definitely get that flu shot. I heard a nurse practitioner once say that, you know, if you get it regularly every year, your immunity for fighting other things get enhanced. Now, I don't know that there's science behind that as well, but up until that point, I didn't even get a flu shot because I thought I never get sick. I never get sick. Now I get one every year because I thought, okay, if I'm boosting my immunity, that's good. And for that RSV vaccine, it really recommends 75 years and older. So I know they were pushing it for younger ages last year, but definitely for that older group, and then for kids as well. And did you all know that you can go on the Illinois Department of Public Health website and pull up a record of your vaccines? Did you know you could do that?
No.
Yeah.
What's the name of it?
Well, it's IDPH, Illinois Department of Public Health. And it's pretty interesting to look at that record. So if you've gone to Osco and you got, you know, your COVID shot, or you got your tetanus shot, whatever you got, they have to submit that to the state. Yeah, so the doctor's offices do, any kind of clinic. And it's pretty great. You know, if you need proof of a vaccine, that's one place you could get it. You could run off that report for yourself, but it's just kind of nice to look back because, you know, it's easy to forget, right? What you had and what you haven't. So look that up.
So we thought.
It would seem, don't you kind of want to keep that just for a keepsake though? I feel that way a little bit about my COVID card, but yeah.
Do you know how far back it goes? I mean,
Well,
I
that-
assume they sort it by social security number.
Yeah, I don't know the answer to that. And I forget what the oldest thing that I saw on there for myself even.
I got a printout from the Jewel over here in Southport, and it went back to the beginning of my COVID shots. Only,
That's just the vaccines.
well, it showed some other shots too, but that's the.
Yeah, I think it's older than that. When I am at the hospital and we have to be gathering data for people coming in for surgery, we can go to that state website, and I think it'll show even a lot older than, so, yeah. Okay, so in terms of vaccines, and then we'll get off this subject, but, so we've talked about flu vaccine, we talked about COVID vaccine, we've talked about the RSV. Can you name, what else, other vaccines come to mind that you think are really highly recommended for us?
Tetanus.
Tetanus, yep.
And pneumonia.
And pneumonia, yep, pneumonia. What I think is kind of difficult is that it all gets a little bit complicated. Now, what I pulled up about the pneumonia vaccines, that there are 3 different kinds. And depending on what you had might dictate when you should have that repeated. So it's not easy in some ways. And I think, you know, I don't know how on top of it doctors' offices are, if it's better to go to someplace like Walgreens, you know, because they've got different records, I don't know, but it used to be that pneumonia vaccine, when they first came out, they said just once in a lifetime, and now I think it's more like once every 10 years, they said for a while, so, and I'm not sure what the current is, but it looks like it depends on the actual vaccine you got. And they've also come up with these like super booster vaccines, right? So there is the Shingrix, I think, is really specifically for like older adults, people over 60, and that's the high dose or the high immunity shingles vaccine, right? So every vaccine that we have, there's like a super duper vaccine that you can get. So you know, I guess being in touch with someone that you trust to have that conversation with your doctor, you know, will be most helpful for you. So yes, the other thing that was mentioned was tetanus, that you should have every 10 years. And so if you don't know, you think it's been longer than that, you should just go and get a tetanus shot. You can, you know, do that at Walgreens or Osco as well. Okay,
Will that be on the state record?
it will be, yes, it will be on there, right?
It's not a state.
It may come up Under MMR, that's the measles, mumps, and, no, the Tdap, it may show up under Tdap, yeah.
Take me to where it's.
Okay, so anyway, that's all about vaccines. Let's move on. The other big thing that there's so much in the news lately about sleep and how important that is. And I
About
am
what?
someone that sleeps poorly,
Oh,
sleep,
about what?
the
Oh,
importance
sleep.
of sleep for all of us. So I'm somebody that does not sleep well, so I'm always probably drawn to this a little bit, but more and more information comes up that says if we don't get good sleep, our risk for diabetes, our risk for heart disease, our, risk for loneliness. I thought a study that was talking about that is, really enhanced. So yes, this was a study that was done, 2,300 participants. And it showed particularly among younger adults that the poor sleep they got, and for them, it was usually shortened hours. Their chance for being significantly lonely in life really went up, right? And so our Surgeon General says that's an epidemic for us right now, is this idea of loneliness. I think like this is preaching to the choir, all of you that come out to be together, in a program like this, you know how to combat that, but a lot of people are very isolated, so,
Right.
and loneliness as itself is tied to, these higher risks of long-term diseases, so. But the study was interesting that it particularly found young people, were struggling more with loneliness in much higher numbers than the rest of us in an older age category, so. Thought that was quite interesting. One of the theories they say is that, when you're tired, you just don't have the energy to put yourself out, right? So engaging in social activities may go down. You may feel more negative about yourself. And that you may interpret other people's emotional reaction to you inaccurately. They say that's part of what they think is going on with the sleep deficit that can cause loneliness. We just don't know how to interpret the clues around us the same way, right? Cues around us. So anyway, one good thing about sleep, yes.
Did they compare the short hours of sleep issue with the interrupted, like seniors, go to the bathroom at
Yeah.
times a night?
This study did not, but I think that's very interesting. It seems like I've heard, as we age and we have to get used to that, we have to turn over more because we have body parts that ache, going to the bathroom, that kind of thing. That in a way, we compensate better than young people that get less sleep. That's what I've read, but
Oh,
I
interesting.
didn't pull that up, yeah. So. All right, so sleep and loneliness, something to keep in mind, right? If you're feeling lonely, maybe just go to bed earlier. Here's another one, that our brain has certain rhythms that happen during the night. And often what happens is, there's a clearing out of old information that happens in there, but there's a firing that can happen with different parts of our brain that helps us create memories, is what they found. So there was some research done on helping people understand if they could enhance that firing, if it helped their memory. So they worked with patients that were epileptic, and some epileptics will have an implant in their brain, so they've kind of got wires in there anyway that overstimulate an area that causes a seizure, so it stops it, is kind of what it happens. So they took these folks that were willing to be a part of a study, and they kind of played around with a firing mechanism from one part of their brain to the next. I'm trying to think, it was like the hypothalamus to something else, but and they tested people. They had a control group, they had this folks that did the test. Those that had the extra little tiny bit of stimulation in their brain at night, they were better in the morning in the memory test than those that didn't. So this research, because it has to do with wires in the brain, doesn't leave us knowing at this point, how is this helpful for us, other than they realize that a small stimulation between one part of the brain and another might help us actually create better memories, better long-term memories. Yeah.
And I heard that having like a diffuser of certain scents at that time for at least 20 minutes can the brain pathway for smelling stuff actually improves memory and sleep.
I think I've heard that too. Yeah. Yeah.
Sorry, Dawn, I didn't hear the beginning part of what you said.
I said that there's research showing that having a diffuser with certain scents like lavender, mint,
Yeah.
that gives a brain pathway that improves memory.
Yeah. Did you have a question?
Yeah.
No?
I just
You just, okay. Thought you had some good input. All right. So anyway, if we can get our brains to fire better at night, that will help. Okay, last thing on sleep before we move on to something else, but there is a new drug, like a pill to take if you have sleep apnea that is under investigation.
Oh,
And so sleep apnea is a pretty big thing. They think 30 to 40 million people in the US have sleep apnea, obstructive sleep apnea, which means that, you know, your trachea is closing up because our muscles get flabbier as we get older. Is one thing. If we're
more
carrying,
flabbiness.
if we're carrying extra weight, that adds to it. There's all sorts of things. If you have a short neck, you tend to have that too. But anyway, so we have more periods where we aren't oxygenating well, right? So you've maybe been around somebody that snores really loudly and you'll like hear a pause and it's like nothing's happened and then they'll, you know, like that.
Right.
So enough of those pauses. And for some people that have severe sleep apnea, they say there can be 400 pauses like that during the night. So, you know, that lack of oxygen, the cumulative effect builds up. So people, you know, don't feel well rested in the morning, and that can lead to, again, heart disease. There's more of a risk for diabetes. There is more of a risk for depression. So it's a significant health problem. And right now, you know, the big thing has been for many, many years, the CPAP machines. Mike and I were talking about that earlier. So it's the mask on your face that pushes air in, tries to keep your breathing apparatus open a little bit more so that you're better oxygenated. For some people that works well, but for many people, they're just not compliant. People don't like to wear it. It feels awkward. It comes off. Their sleeping partner hates it. You know, there's all kinds of reasons. So those don't work the best for anyone. You've maybe seen on TV, there's a device called, is it Aspire or Inspire or something? So that, I don't know the specifics of how that works. I just know there's a doc that had started doing those at my hospital, and the surgery to implant that thing is like a 5-hour surgery. It's not, yeah, it's kind of an intensive surgery. I was surprised. But, and I've not heard any research about that. But anyway, so if there is a pill, right, that we could take that might help that would be a plus. So there was a study going on. I think it's in phase 3 trials now. The phase 2 information looked really good. The drug is by a company called Apnea. It's called AD-109. It doesn't even have a num,
I'm
AD-109.
sure they'll have a spiffier name
Yeah.
as time goes by.
And it combines 2 drugs. It combines a drug that treats overactive bladder, and it also combines a drug that treats attention deficit hyperactivity disorder. So, interesting.
That, green now.
It probably would, yeah, it would probably do that. So, but it showed, you know, significant meaningful improvement in sleep apnea, it said, is, you know, from this, at least the information. So we can be on the lookout for that.
You won't have to get out of the body is awesome.
Yeah, that's right. That's
Bonus.
all right. I told you I was done with vaccines, but actually we're going back to vaccines. Because there's a study going on about a vaccine against urinary tract infections. And there are many people that really suffer a lot with chronic UTIs. I mean, it's really, you know, it's really overwhelming for people. So this is done, it's called MV140 vaccine. It's produced by a Spanish pharmaceutical company called Immunotech, and it's known as Euromune. It's something that you spray into the mouth. You get a couple of doses of that.
And they're gonna give it a name like Euromune?
Yeah, they should come up with something better, shouldn't they? But it was a small study. That's the downside, but not, this is what the conclusion was. That 9 years after first receiving the sublingual spray of this vaccine, 54% of participants remained free from urinary tract infection. So if you can go 9 years without a UTI, that's pretty impressive if you kind of just lived with, you know, multiple in 1 year. So anyway, I think that's really exciting news. So we'll have to keep an eye out for that coming down the pike too. And then the last is really just more of an interesting article for me, is that the article is titled "Is Most Parkinson's Disease Man-Made and Therefore Preventable?" And, you know, Parkinson's is like, you know, it's so high for us. It says it's doubled in the past 40 years, and the prediction is it's going to double again in the next 20 years. So there is a theory that this trichloroethylene which is part of the Camp Lejeune. You've seen the advertisements about that. That the relationship is very high between that and Parkinson's. Like if you've had exposure and it gets into well water, that, you know, your chances are pretty significant. Yeah, that you will have Parkinson's. The one thing that came out of here for me is that it talked about like, if you had exposure as a child, it may take 30 or 40 years for that to develop, right? So it kind of stays in our system. It's fat soluble apparently. But they talked about two things, like if you're someone that was around solvents for a lot of your life, you know, maybe you had a dad that, you know, worked in some chemical factory or, you know, had to deal with solvents, put you at a higher risk. It had a really higher chance of that too. And they said that that chemical is used in the dry cleaner. So it mentioned this in that study that they found people that lived in apartments above a dry cleaner, like their chances of having Parkinson's is way, way, way higher than the average, you know, person. I don't know, was that you? I'm sorry. Oh, in the building? Yeah, I can't remember now. We can read this, Judy, and see, but I thought that was very fascinating, you know, it kind of goes back to these things that are so much a part of our lifestyle, right? Although I did not grow up in a family, we didn't go to the dry cleaners hardly ever, but I know friends, you know, men who worked in business, their clothes were constantly dry cleaned, right? So they were in the dry cleaner, they were wearing products that came out of the dry cleaner. So anyway, just a fascinating study. Calls us again to figure out what we need to change about our lifestyle, right, to make everybody healthier. So anyway, that's all I had for you today.
Do we have any questions?
Yeah, I have.
Oh, okay, go ahead, Mike.
There's been a big deal made about social media, you know, with young people, and it's like a national hazard.
Yes.
Have you seen anything impact about seeing it, you know?
I've not seen anything, but we're all probably seeping into that more and more usage of it all the time, right? Although I do think probably a 50 and up population are way better at not feeling so tied to it. But yes, they think that that's part of the depression for young adults is that the screen time, you know, this is where they're getting all their validation and interaction as opposed to face kind of stuff. Yes, that's right. But I haven't seen any study that compares that like in adults. Okay, well, thank you. Well, you're welcome.
Thank you.
Yeah.